Hi everyone, my name is Beryl and I'm a student with UMass Global University. I'll be doing some psychotherapy today and I'll be utilizing 3 different forms of psychotherapy with my patient today. I would like to tell you a little bit about my patient. His name is Eric. He's 62 years old, retired with 5 kids. He recently relocated to the United States about 2 years ago. He presents with anxiety due to financial difficulties and constantly being worried about his kids he left back home. His chief complaint is anxiety and stress. This is his 3rd session. His main worry is financial difficulties, not being able to provide for his family, and the problems he experiences with his wife due to reduced income. For the purpose of this video and therapy, I'll be using cognitive behavioral therapy. It focuses on reducing negative thoughts, also known as cognitive restructuring, and increasing pleasurable activities, known as behavioral activation. That is, doing things even if you don't feel like doing them, and improving assertiveness and problem-solving skills. We will be using terms like core beliefs and self-esteem. The second modality is motivational interviewing, which engages the patient. It is a collaborative, person-centered process to help the patient plan for changes. It engages the patient to talk about issues and concerns and build a trusting relationship with the therapist. It uses a conversation to identify patterns the client wants to change. This will be used to elicit clients' motivation for change by increasing their sense of importance. And it involves practical steps that the client needs to do to get the change. The third will be reminiscence therapy. It is a form of psychotherapy that improves self-esteem and provides older patients with a sense of fulfillment and comfort. It involves recalling past events like listening to old music, looking at family pictures. The goal is for him to become fully aware of his present and relive good memories that can help improve his mood. It is helpful for depressed older adults and will also help reduce his anxiety. Talking about cultural competency, it was assessed in the first visit. We acknowledge that it affects decision making. In this scenario, the patient's culture will not negatively affect his response to treatment. I'm providing these 3 therapies so the patient can figure what he loves best. I believe they all work together, and if he wants to use all 3 or choose one that he's more comfortable with. So now I'll introduce you to the patient. Hi, Mr. Eric. How are you doing today?
I'm doing very well, thank you. And you?
I'm good. So this is our 3rd session. Last week we spoke about the thinking, feeling, and behavior triangle.
That's correct.
How you think affects how you feel and how you behave. We also spoke about writing down 2 positive self-statements for the week and recording the number of days you said it. Were you able to write down these statements?
Yes, I did.
Alright, can you tell me what you wrote?
Okay, the first positive statement I had wrote down, I am a loving parent. And the second one, I am in control of my feelings.
Okay, yeah, those are all good statements. Were you able to say them all 7 days of the week?
Unfortunately, no. I was able to say it from Monday to on Sunday, Monday, and Tuesday. Then a relapse for about 2 days, and then I picked it up again on Friday and Saturday.
All right. So what were the barriers you had?
I got anxious when I spoke with my family, I think on Wednesday, and I was really nervous and I felt bad, so I just abandoned it.
Everything. Okay. All right. So we also spoke about automatic thoughts, and you mentioned that you were a loser.
Mm-hmm.
All right. So today we will focus on self-esteem.
Okay.
Do you have your booklet that we use?
Yeah.
Okay, so what is self-esteem? How you see and feel about yourself.
Okay.
Self-esteem needs to come from within you. Positive self-talk can change how you feel about yourself.
Okay.
So here are some signs of poor self-esteem: being depressed, getting jealous, getting angry at others, being worried about what others think of you, giving into pressure from co-workers or family members, not trying things for fear of failure, using drugs and alcohol, and acting like you know everything. And these are some signs of positive self-esteem: not being afraid to try new things, feeling happy and confident, not being overly concerned with what others think, and standing up for what you believe.
Okay.
Alright, so people often cope in unhealthy ways like emotional eating, which involves eating junk foods, using drug or alcohol, smoking cigarettes, and acting out in angry ways. Do any of these apply to you?
No, not for the moment.
Alright, so that's good. What are positive ways to build your self-esteem? We have changing of your self-talk and talking more positively. Positive self-talk takes practice, but it's very important in helping you to change your negative thinking and your self-image. So I have a question for you. Is your cup half full or half empty?
I'll say it's half empty because I've not been able to fulfill a lot of my dreams of coming over here, things that I thought I would have accomplished by now. So it's not yet full, so it's half empty, way half empty.
Alright, so it's understandable because you kind of see that you are a failure, right? But people who see their cup half full or focus on the good instead of the not so good things in their life tend to be more positive and feel happier. A daily attitude of gratitude will help improve your mood.
Okay.
So can you tell me 5 things or 5 people you are grateful for?
Well, I'm grateful for being alive right now because I have some of my age mates that are dying. I'm grateful that I have a loving wife. I'm grateful that I have a family. I'm grateful for being here and that one day I might bring all my family here with me.
Right.
And I'm grateful that I am a religious and God-fearing person.
Great, great. So you see, I mean, there's always a lot of things to be thankful for. And if we focus on these positive things, you tend to worry less about what you have not achieved. Think positive and you begin to feel more positive. Remember, how you think is related to how you feel and how you act.
Okay.
You can also change the things you do every day that have become a habit. Alright? So, now you know the most important steps to change is making a decision, setting a goal, believing that you can do it. Anything is possible when you believe. Alright?
Okay.
So do you have any questions about this cognitive session we just offered right now?
No, not at the moment.
Alright. So I'm going to send you home again with more assignments, which is writing down your positive self-statements for the week and ensuring you say them 10 times every day.
10 times every day?
Yes, every day, to remind yourself of how positive or how great you are. That way you think more positive.
Okay.
So I'm going to move to the second form of therapy, which is motivational interviewing. Can you tell me about what is going on in your life right now?
Oh, right now I am since I moved over here, I'm working, but not the type of job that I had hoped that I'll be able to get a high-paying job, so that I should be able to bring my family over here. So that is really making me to be anxious and building up my anxiety and things like that.
Okay. So what are some of the negative outcomes that can come as a result of this move?
As a result of me moving here?
Yes. Or what you're going through?
Or what I'm going through? Well, I can just give up totally. I can go back. But when I think that I want a better future for my children, I want to stay and try harder to see if something good can come out of this.
Okay.
Yeah.
Right, that is a good thought. So what are some of the things that are good that might come as a result of, your moving?
Oh, well, my wife will move over here. My children have an opportunity for a better education and for a better life for them and their children, my grandchildren. So that is something positive that I can say my moving out here will lead to a better life for my wife and for my children, and eventually for myself, and maybe having more money to spend also.
Right, right. I know it's really tough being away from your family. You've always been there, being present, and seeing how things are going. It's almost like things are out of your control.
Yeah.
And you're also worried that your children may go wayward. I mean, including the financial difficulties you have.
Mm-hmm.
But right now, you identify some good things that can come as a result of this.
Yeah.
So I think you should focus on them. And the next question I have is, what are some of the things you can do to improve your situation?
I'll probably have to go back to school or take some certification to try to improve and adapt to this to the United States, because so far I've not been able to get a very good paying job. So maybe if I go back to school or take some certification, I would be able to improve my lot and earn more money and be able to bring my family over here faster.
Right. So have you thought about any certification yet, or anything you want to do?
I think I'll have to. I'm thinking more about doing something in IT or in the healthcare business.
Okay.
That would be, say, I don't know, 3, 4, 5, 6 months or so that I can see some positive results in a short time.
Okay. How soon are you looking to start the training?
I was thinking of starting that in the fall.
Okay, good. So I think right now is a good time to start looking into the schools and drop your application just to be, in good standing. How soon can you start dropping applications to schools?
Well, I can start by the end of this month, the end of June, since school starts in August here, so that I should be able to be admitted in school or in a program by August. Okay. And start that.
All right. Yeah, I do know the IT field has some, short certification programs, mm-hmm. which can earn you a decent pay that lasts probably about 6 months. Mm-hmm. So it's a good plan, and starting at the end of the next month is good.
Okay.
So when you came in, we did a anxiety screening, mm-hmm. and it's called 12, which stands for moderate anxiety, right?
Okay.
So right now I would like to do a reminiscence therapy, mm-hmm. where we'll relive your favorite memories of you back in your country, right?
Yeah.
So on a scale from 0 to 10, what is your anxiety level right now?
I'll say like a 7.58.
Okay. So what was your favorite music?
Bottle dance used to be like a cultural dance that I would dance to go out to an event with my wife and dance and relax and feel happy and feel fulfilled.
All right. Do you mind us playing that here? Are you able to pull up your YouTube and just...
Yeah, I think, let me see if I can pull that up on the YouTube.
Okay. So I'm giving you this opportunity to listen to your song and see how you feel about it.
satisfy everyone's desire. Only hard work unlocks the door to achievement. When there is life, there is hope. When there is life, there is hope. Life is a battle full with ups and downs, so sister. When there is life, there is hope. Anyway, in the world there are always problems, so you can never satisfy everyone's desire. Only hard work unlocks the door to achievement. Monica, Jimmy, chop me and chop some more. Monica, Jimmy, chop me and chop some more. The one way in the middle, the son of my own woman. Let me and chop some more. The one way in the my belly, now my own no. The no go put on for skin, now for dreams, so. Any my head, and for in ego. Monica, give me chop me and chop some more. Woman, give me chop me and chop some more.
Well, that was a great music.
Yeah.
That's a good meaning to it. Where there is life, there is hope,
Yeah.
right?
Yeah.
Okay, I think it actually made me feel better too.
Okay,
So
that's good.
after listening to the music, how will you rate your anxiety on a scale from 0 to 10? How do you feel right now?
Like a 4 or 5.
Okay.
Yeah, I feel a lot better listening to music, thinking about the old times, thinking about how we used to dance and enjoy ourselves.
Right, I can imagine.
Yeah.
You know, just going out and having fun and all of that. So I mean, what symptoms were most troublesome to you before coming in today?
The anxiety, low self-esteem, and sadness. Yeah, nostalgia.
Difficulty sleeping.
Yeah, because of that also I would think at night a lot, and it would be difficult for me to sleep. So difficulty sleeping also, yes.
All right. Anyway, so is there any of the therapies you would like to know more about, or you're kind of comfortable with all 3 therapies?
I think all 3 therapies are good.
All right.
Yeah.
So which one do you lean more towards?
Reminiscence on thinking about the good old days, and thinking about how life used to be so nice and fun, comfortable.
Okay, nice. So I know we did 3 different. One had some assignments. One involved like talking, which was the interviewing, and this was, listening to the music. So we can incorporate the reminiscence therapy when next you come for your next session.
Okay.
But one thing I want you to take back home is the positive self-talking. It is very important. Keep practicing it. And next week we'll talk about dealing with stress and cope.
Okay.
All right. So it was nice having you today.
Okay.
Have a good day.
Thank you very much.
Right.
Thank you. This has been quite helpful.
Okay. I'm happy it was.
Yes,
Okay.
yes.
Have a good day.
Okay. Thank you. Same to you.
Hi everyone. So we came to the end of our therapy, and I believe Mr. Eric was pleased with his therapy, and it was a success. We addressed 3 forms of psychotherapy, which were cognitive behavioral therapy, motivational interviewing, and reminiscence therapy. Mr. Eric leans more towards reminiscence because it brings him good memories of his time back in his country, and it improves his mood. We will be meeting next week to continue cognitive behavioral therapy, and we'll also incorporate some reminiscence therapy into it, so he can be happy and be able to tackle his daily anxiety and stress better. Thank you all for listening to my presentation and therapy.